Well, thank you. That's excellent testimony from all of you. It's greatly appreciated. I now recognize myself for questions. You've really touched on some things that I appreciate greatly. I've been in Vietnam twice in the last year. And I don't know that WHO was involved, but more our own CDC. And I think the work that we did with our CDC and the Vietnamese government during COVID was a tremendous plus, not only for the lives of the Vietnamese people, but for our diplomacy. And so there's great opportunity. So like I said, I don't know if WHO was involved with that, but the importance of the WHO being trusted comes into play with the example you just gave, Doctor, where they came in and said, trust the Americans on this, let them work with you. And if that's what's needed for that conduit, then they certainly need to be the trusted institution that we want them to be and that they have been. And make sure that everyone agrees with that. And I suspect everyone here would agree that politics getting involved with science can create a distrust among the public at large, just as politics always does. But I guess with your knowledge of what we have now and looking at COVID-19, I ask, was in your opinion, China forthcoming and transparent regarding COVID-19? Because the WHO put together a group to study this and go to China. The only American in the group was Dr. Peter Daszak of EcoHealth Alliance, and he maybe should have been somebody that even recused himself because he was a collaborator with the Wuhan Institute of Virology, and China was deciding who got to go. And so these are things that raise people's concerns. And Secretary Blinken said we've got real concerns about the methodology and the process that went into their report, including the fact that the government in Beijing apparently helped to write it. That's not an independent organization then. So do you agree with the Secretary's assessment, and what are your thoughts during that time and moving forward? And then we can go down the line.
Thank you, Mr. Chairman, and thank you for your reflections on your travel to Vietnam. I, too, have been able to visit the work of CDC and our partnership with WHO there. With regards to your question, it's an important one, especially because we have a lot of lessons to learn regarding COVID-19. And unfortunately, one of those lessons is the importance of transparency. We're quite disappointed and share your frustration with the government of China not being as forthcoming as they should have been with WHO at the time, especially because getting to the bottom of this crisis is critically important, as you said, not only for COVID, but for any outbreaks moving forward.
Thank you, Chairman. I fully agree with your opening remarks about the trust capital that is required to dealing with global disease threats. And that comes with the ability to be fully transparent, to be accountable, to report in a timely fashion, and also to cooperate. And all of these elements were lacking in China's ability to cooperate with WHO and the world. And when you have a fast-moving respiratory disease like COVID, all of these elements are very important for the global health security. I think the burden is still on China, that for the past 3 years, China has not been forthcoming the way it should be in working with WHO, working with us directly, so that we just understand what the origin is, of the virus is, so that it can better prepare us for the future. As we've all said, it's a matter of time before we face with another threat. Yes. So I think I fully agree with you that we need to build a trusting relationship that will enable us to respond in a very timely fashion.
I'll add only that I'm in complete agreement with my colleagues China was not forthcoming early on about human-to-human transmission. As we noted, there's a common reluctance. Under SARS, which happened years before, WHO pushed hard and was public about that lack of forthcoming behavior in a way that did not occur in this particular instance. However, WHO got a lot right that were critical to getting vaccines out to the world, getting treatments out to the world. We'll say that we have also seen that history has shown that they are capable of improvement. After Ebola, where response to emergencies were very slow, U.S. pressure ended up driving the creation of a global health emergencies program that massively improved response on the ground in many subsequent outbreaks. And similarly, after COVID, U.S. pushed successfully for the creation of a standing committee on health emergencies, preparedness and response. And that's already giving U.S. and others more real-time oversight of handling in the case of potential PHICs, the public health emergencies of international concern.
I think new methodologies coming forward are going to benefit us all in the future. I guess my real concern is if a member is not participating in the way that should be expected, not only how do we call them out in a way that might get them to behave as they should, so my question would be, do we say, well, you can't be part of the WHO if you're not going to adhere to the rules? Or is there some enforcement mechanism? I don't know where to turn on that if it were to happen again in the same way. And I don't know so I'd love to hear your ideas as you deal with the WHO and the frustration that everyone had.
So I will try and respond to this question, Mr. Chair. Again, it's a good one, especially because we need everyone to be good actors around the table. One of the things that we are able to do as board members of WHO is at least track that very level of accountability and really understand how we all come together to support the work of the organization. As it turns out, we are board members alongside the Chinese government as well as other actors like Syria. And so it's one of the reasons why we want to remain at the table, if nothing else, to be a voice in that room and ensure that that voice is rooted in science and in the important work of WHO really serving not only America but the world in ways that we want to see.
Chairman, I agree with my colleague that we have to be at the table all the time and exercise our leadership, because it is by being at the table that we rally our friends and allies to put pressure across the board on countries that may not want to cooperate fully. We know that when we are not at the table, others will take our seat at the table. I think we have to always be at the table and continue to put pressure on it. The administration has been very clear on this, that we have to work in the area of global health security. We must work with people that we agree with and with people that we do not agree with, because we just don't know where the next threat will come from. And the way to do that is the platform for that is WHO. I can't think of any other platform that we should that could serve that role. Now, the burden is on all of us, the burden of leadership, to continue to put pressure on WHO to reform so that it can be more agile, it can be more forceful, and it can be more accountable in responding to or putting pressure where it's needed so that countries can be more transparent in their reporting.
I'll only add a couple of points to my colleagues. One is that we want respect for our sovereignty, and so we also limit how much WHO can control or demand things of us. And that is one of the challenges here, that we are protective of our own sovereignty and therefore do not want to have those tools challenge, potentially challenge us or other member states. The second point about possibly, well, then could we force out a China that does not adhere? And we want China under the tent. Once a country pulls out, they become a blind spot in our national security. Currently, China does participate as a network of 129 countries that submit flu and other illness data. It's the reason we have an effective annual flu vaccine, because we have access to information being supplied through those means. And so we want to have China continue to be a joint actor in this work. And so that leaves us in a space where it's diplomacy. Now, the additional reforms that the U.S. is advocating for under reforming the international health regulations are to make a clearer tiered response. Right now, we just have a public health emergency of international concern, and that's the declared level. And we're looking for a 3-level set of tiers so that there is an earlier indication that countries have a health issue developing of concern. There are clearer standards about what transparency requires, and then clear requirements that WHO has to live up to for reporting, making public, and indicating when countries are not adhering to those. So that set of commitments are a part of what we're aiming to negotiate and produce in strengthening international health regulations and the pandemic accord.
Well, I would also like to see something where the host nation, in this case China, doesn't get to decide who the United States sends and doesn't restrict who we send. Because frankly, I'd have been very pleased if any of the 3 of you were there when that occurred. With that, I yield back. And